Dr. Olugbende Obazee Ajayi, Post-Fellowship Senior Registrar at the Anatomic and Molecular Pathology, Lagos University Teaching Hospital, Lagos, Nigeria. Dr. Olugbende Ajayi is a passionate physician and anatomic pathologist with a strong foundation in medical education, research, and clinical service. A graduate of the University of Ibadan, completed his residency and fellowship in anatomic pathology at the Lagos University Teaching Hospital. He has trained both locally and internationally, including a research fellowship in the Institute Jules Baudet in Belgium. With over a decade of progressive medical experience from internship to advanced pathology practice, Dr. Ajayi has published widely in peer-reviewed journals and presented at global conferences such as the OSCAP annual meetings in the United States. He's a recipient of several prestigious awards, including the UICC Technical Fellowship and the OSCAP Foundation Global Partner Travel Grants. As someone who once benefited from educational support and mentorship, Dr. Ajayi is deeply committed to inspiring and guiding the next generation of medical professionals. His journey exemplifies resilience, focus, and power of staying true to one's purpose in healthcare. Thank you.
Thank you, Fauzia. Dr. Ajayi, we are honored to have you with us today. We're looking forward to learning from your wealth of experience. You have the floor, sir.
Thank you very much for that warm introduction. It's my absolute pleasure and delight to be here. And I have a couple of things to say. One, I want to thank Professor Karim for giving me the opportunity to be able to give this talk. Can you hear me, please? Can you hear me? Okay.
Yes, we can.
Yes. So one, I want to thank Professor Karim for the opportunity to be able to give this talk. I must say that she is like she's like a superpower for me in terms of how she juggles her career and then how she makes her career so rich in terms of many things that she's involved with, and she's able to combine all of that in a very, very effective way. And that for me, it's something that I aspire to. So that's one. I want to thank her for giving me the opportunity. And then second, this particular topic cuts home to me in two ways, for two reasons. One, during the warm introduction, it benefited from academic mentorship and scholarship. That is true. At every point in my life, from secondary school to the university, and even to residency, and even till now, I still have mentors that I look forward to, that I speak with, and they give me ideas on how to, especially if I'm in a fix. And Prof is one of them, and I want to thank her for that. And secondly, when I finished my medical school in 2011, I must say that I was kind of lost. The only thing I knew then was that I loved pathology and I wanted to specialize in pathology. I didn't have that broad view of what I could do in terms of the options I had and all of that. So when I was asked to give this talk, I was quite excited, because at least even though I was not able to have that experience at that point in time, I'll be able to help other people. I have been able to do that in my own family, because I'm the first in my family, and I have two other younger ones who are doctors, so I'll be able to guide them to move fast with their career, since I didn't have any of such. And I'm very, very delighted that I'll be able to do that at a larger audience. So with that, I'll start my talk. I want to see if I can share my screen. The topic for today is exploring career paths in health and medical services. This is not to give a full talk about the specifics about each topic, but the idea is to be able to let us have a conceptualized view on how to approach picking a career in health sciences, and then the various options you have to be able to that you can explore in the health sciences. And then at the same time, you should also be able to know the right tools to look for when you are trying to choose a path in health sciences. And this talk can also be extended to other aspects too, when you want to choose a career. So the outline of the talk is this: introduction, choosing a career in healthcare, the major career paths in health sciences. We'll have like a case discussion, like a scenario, so we can have an idea of the various opportunities and how jobs are generated in health sciences. then how you can get certificated, how you can get certification for various specialties and subspecialties in health sciences, the emerging careers in health sciences. I think that's an exciting part. And then I'll conclude the presentation. So the medical field is broad, and the knowledge in the medical field is changing every day. So, and this field range from direct patient care to research, to academics, to provision of clinical services, and then use of technology in medicine. So, those of us who have this engineering mind, you still want to be in medicine, there's actually a place for that. Administration too, as well as law, medicine. And the education requirements for those different aspects in health sciences vary widely. The educational requirements vary widely, and usually professionals are allowed to focus in areas of interest because the knowledge is so wide. What you want is that somebody is really, really good at the little aspect that he knows. And as you will go further, we know that the medical field is a teamwork. So the field is highly rewarding both professionally and personally. And this presentation will explore the various pathways that you can have. So before we go into that, let's first of all talk about choosing a career. What do you want to use in choosing a career? Oftentimes in this part of the world, what most people do is, okay, what aspects pays the most money? What aspect can I get a job in? And then you go for that, whether or not you enjoy doing that. That should not be the case. One, you should be able to understand yourself. You know your strengths and you reflect on your interests. What do you like to do? What makes you think? What gives you that rush when you are doing it? And one of the ways by which you can do that is to keep a journal of your hobbies, your achievements, and you know exactly what you love and what you exactly and how you are in your elements when you are doing that. So you'll be able to know exactly what you love and what you enjoy. And then you should have the right personality traits. So you should know the career that you're going into, and then the exact personality traits that you would need to be able to excel in that career. And then you know if you have such personality traits. In healthcare, you should have empathy and compassion. You are providing services for patients. And this cuts across all spectrums, academic, research, in any aspect. Empathy and compassion is very, very important. So if you are the kind of person that is self-absorbed, really don't know how to empathize, and you don't have that compassion, then this may not be the profession for you. You should have a strong listening and communication skill. Very, very important. You are dealing with patients, you are dealing with human beings, and you should be able to know what they are talking about, the nuances, both direct communication, what they are saying to you, and what they are not saying to you through their body language. You should have excellent listening and communication skills. You should have the ability to work well in a team. In the medical field, there's no hero. Everybody works as a team to be able to get an absolutely fantastic result for the patient. So there is no I in team. Everything is that you want the patient to come up with a good outcome. And you should learn to be able to work well. If you're not the type that works well in a team, then maybe the medical or the healthcare profession is not for you. You should have emotional stability. Sorry. So you should have emotional stability and be able to stay calm under pressure. Nuances from people because of the whole. You have emotional stability and ability to stay calm under pressure. This is because you are dealing with patients, oftentimes they are sick, and then emotions are running high. I think, as a matter of fact, my dad used to tell me that the day I was born, he had an altercation with I think one of the nurses, because he felt that she wasn't attending to my mom fast enough, which is very, very unusual because my dad is usually very, very calm. So if you are going to work in the healthcare system, you should have that emotional stability and ability to stay calm under pressure. Hard work and diligence. You don't say because you've finished your undergraduate or postgraduate. No, it's hard work, it's hard grind at every point in time. you've done this, the next thing, because that's how you're able to excel. The in the medical field, you should have a commitment to lifelong learning. I'll use Prof again as an example. She's still attending conferences, either physically or via Zoom, and she has inculcated that in us. She has a conference to attend that she thinks will benefit the department. She puts it on the WhatsApp group. Go and attend. Dr. Ajayi, are you attending? Are you in that Zoom meeting? This is because the medical field, you need that hard work. So if you're the type that don't work hard work, you just want to stay and laze around, you are not going to excel. And even generally across professions, you need to have that hard work and diligence. Flexibility and adaptability, as the medical field is changing every day, as well as at the same time, so patients have different needs. So you should be able to know how to adapt and don't say, okay, this is how I've always been doing things. Even though when things change, you still continue to do it the same old way. You're not going to get the best result, and then your practice would not be the best. Honesty and trustworthiness, being ethical, very, very, very important. Because if you're not honest, if you're not trustworthy, then you have no business being in even any profession, not talk of the medical profession where you're dealing with lives. So choosing a career in healthcare, what you have to do is, number one, select a subdomain, research the educational requirements for that domain, and then you consider lifestyle for that subdomain, and then you explore the possible job markets for that domain. So the healthcare is wide, and there are various roles to which you can fit in. You already, at this point, you have already known what makes you tick, what you enjoy, and what traits that you have. So by the time you've narrowed your search to these aspects of the healthcare parts that I want to specialize in, you research it. Those who work there, if you can speak to them. If you can't do that, then you can listen to podcasts, YouTube videos from those who are already in the field where you intend to specialize. So once you do that, okay, you go for the you now research the educational requirements at various levels of education, how to enter into it, your postgraduate requirements, undergraduate requirements. If you feel you have these requirements, or if you feel you can meet these requirements, then you go for it. Then you also consider lifestyle, because healthcare jobs vary in schedules. Some involve you staying on ground long hours, standing and grinding. Some it's a little bit less demanding. So you, like I said, at this point, you know what makes you tick, you know what you can cope with, and you know what you cannot cope with. Because it's usually not the best, whereby you go into a field and then you find that this is not usually the best for you. Remember, you're able to do that for a long period of time. Yes, one could argue that you can change and then change your specialty, but even at that, you'll have lost some time. But if you know what you are doing, you are focused, you know exactly what makes you think and what you can go for, you save yourself a lot of time and heartache, and you go for it. Exploring the job market, very, very important, because unless you don't want to be honest, we want to be able to work and earn a decent or a good living. So you look at the career opportunities that are available in that specialty, and then you see if they are available. Because sometimes some of the career opportunities may not even be available in your region. You might have to go to another region, you might have to go to another country. So these are the things that you have to look at when choosing career paths in health sciences. And the rapid extension of scientific knowledge and the complexity of medical care has made it impossible for physicians to maintain expertise in all fields, not necessarily physicians alone. Every aspect of medicine, it's really broad, it's diverse, knowledge is changing every day. So like I said, what you want is that you want an aspect whereby you are very, very competent in that subdomain. And it has been shown that individualized approach to patient care leads to better patient outcomes. So if you have individualized outcomes, that tells you that you're going to have different ways of going about things. And that is why the medical career is particularly unique for job opportunities. This has led to subdomain specialization, allowing healthcare workers to focus deeply on narrow areas, just like I've said. So broadly, the health science career pathways. You have diagnostic services, therapeutic services, supports biotechnology and research developments. In this aspect, we also talk about teaching, as well as health informatics, and then support services. So you can be a physician, you can be a non-physician. And for each of these aspects, you can work in the laboratory or you can provide therapeutic services. Those who work in the laboratory, these are the diagnostic aspect, and those who provide therapeutic services, they deal directly with patients. So just go briefly into the different career paths or the different careers, not delving very, very deep into specifics. So one, physician laboratory, you have the pathologist, which I'm one, histopathologist, the chemical pathologist, hematologist, and then the microbiologist. These aspects, they basically help the doctor in being able to confirm a diagnosis. Non-physician laboratory. In laboratory, the doctor cannot do everything. Like I said, it's a teamwork. So you have medical laboratory scientists, molecular and cyto technologists, pathology assistants. These are the people that to run the lab to ensure that results are brought out promptly and they're interpreted to ensure maximum patient care. Non-laboratory, okay. Non-physician, non-laboratory, we have the radiology technicians, ECG technicians, and the rest. So therapeutic services are usually the most popular. This is because they have direct, they're involved in direct patient care. These are the ones that patients see. These are the ones that patient relatives see. And they think that that is what you only do. But for that guy that you're saying, or the lady you're saying, to be able to ensure that you are optimally managed, it's a team that works behind this, oftentimes behind the scenes. And this is what makes the outcome very, very good. So like I said, all of this produces various opportunities, various career pathways to be able to key in and then find out the one that fits for you and your goals in life, and you can go for it. The diagnostic careers, if this involves use of tests and equipment to be able to detect and diagnose diseases, and these are very, very broad, from pathologist to pathology to radiology and health informatics. Information is wealth. Data these days is becoming a big thing. How you handle data is very, very important. Data analyst, data manager, data administrative assistants, and healthcare billing. All of this, they need to be managed. The doctor that you see cannot do all of this. So you need support. You need to be in a team to be able to ensure that patients' data are handled effectively. Biotechnology and research. One of the reasons why we are human beings is to improve existing systems, and the way you do that is by academic research and use of biotechnology in medicine. So support services, those who will keep the facility, those who will keep the facility running, those who will keep the facility running, those who will maintain the smoothly. And like I said, those who are engineering inclined as medical students or other healthcare field courses, this can be an aspect for you. Then other careers in healthcare, medical illustrations used in teaching. Other careers include medical illustrators, law, hospital administrations, healthcare consultants, and policy advisors. These are other aspects so that you can also that can be tailored. They are not directly related to medicine, but they can be tailored to the medical aspects. Law, hospital administrations, and then consultants and policy making. So any of these services can be done at various levels. You can be involved in the academic, in the provision of clinical services, in teaching and research, in policy making, in private or public sector. And you can do any of this with the combination of that you fit. Academic, clinical sciences. Prof, for example, is in academic, she's in clinical sciences, she's in teaching and research, and she has been in leadership positions in the hospital, which means she has at some point directed the policy making in the institution. So you can be involved in any of this to ensure that you have that career opportunity, and these opportunities are open for you, and you can do this in combination depending on what makes you tick. So we're going to do like a case discussion. So I just try to have like a story, so we have an idea of how the field itself is a teamwork, and how jobs and how career opportunities are created within the healthcare sector. Like I said, the healthcare sector is particularly unique because it has the potential to be able to open up different opportunities. So Mr. Karim was, I can't read, something is covering. I have this thing covering my screen. He was climbing the stairs when he suddenly fell and collapsed at home. His wife had him fall and rushed into the hospital and found him unconscious. She was found by a nearby hospital. I have started some things. This basically tells you these are potential career opportunities. These are potential career openings in the medical line. He called a nearby hospital, who quickly dispatched an ambulance. And on his way to the hospital, IV lines were set, and a quick history was taken. On getting to Lut, he was taken to the accident and emergency department. And by the time he got there, he had regained consciousness. History was taken, and the nurse was called into access. A doctor who was then called to evaluate him. He found him to be pale, emaciated. His abdomen was distended, and the mass could be palpated at the right upper part of the abdomen. He ordered various tests: full blood counts, AIU creatinine, urinalysis, abdominal CT scan, and the consult was sent to the gastroenterologist to review. Plans were made to transfuse with 2 units of blood. CT scan showed a stomach and an upper GI endoscopy with biopsy. So CT scan showed a mass in the stomach, and he later had an upper GI endoscopy and biopsy. The biopsy results showed a gastric adenocarcinoma, and he was worked up for surgery. He had partial gastrectomy a week after getting to Lutz, and was discharged a month for follow-up. So this story give us an insight into the diverse options that you can have in the medical profession. So the patient had an emergency at home, and then he called an emergency service. Now, well, we may not be familiar with that in this part of the world because maybe we don't really have a very, very robust and active emergency service. But those who would operate that would have to be medically inclined at some form. So you can finish in any of these allied sciences and be involved with that. And then usually what they do is that when they receive such phone calls, they take brief history, and then they know they have an idea of what's happening, and then they know how to route you to the facility that has the to the hospital that has the facility that we need for that patient. Even though we don't have that here in this, we don't have a robust thing here in this part of the world, that can be something that can be done at the private sector level, where you have a company that helps people who have medical emergencies. Then they pay that, and then you do that for a fee. And this is something that can be explored. The paramedics who assisted the patient to get to the hospital, that's also, they also have a team, so they also have a role in the team to ensure that the patient gets optimal care, because time is of essence when you have medical emergencies. Medical equipment, like I said, those who have the engineering mind in their house, this is where it's something that you can get yourself involved with. Because I think I have a friend I have a classmate who was a classmate of mine. Now he's in the US, and then he's into biotechnology and using engineering in medicine. He was my classmate in secondary school, and he was really, really good at maths. I don't know, for whatever reason he decided to do medicine, but this is something that you can do. Medical informatics, the nurse that tried the patient, when the patient was in the theater, you have nurses that would ensure that the surgeon, the doctor cannot just do everything. It has to be a team. The phlebotomist that will take the blood samples, from the patient to run the test. This patient had the surgery, some part of the stomach was removed. He has to be followed up. You will need a special dietitian. You will need a psychologist, because all of these are life-changing events and that can affect your emotions. Blood tests, radiology services. The radiology machine itself has to be made. The radiology machine itself has to be maintained. The radiology film itself has to be interpreted. These are all various career opportunities that you can have in health sciences. The patient had a biopsy done, the pathologist, histopathologist, he had blood transfused. The hematologist will be in charge of ensuring that the blood distribution is safe. Then the surgeon that did the operation, the anesthetist that put the patient to sleep, and then the pharmacist that gave the patient drugs at various points in time. So basically, what you should have noticed is that all of this, when you come to the hospital, you see the doctor, you see the surgeon, and most people have this misconception that they are the ones that can only work in the healthcare field. You have a variety of career opportunities in the healthcare sector because, like I said, the healthcare sector is a team. You work in a team, and everybody has his own role in that team to be able to ensure that the patient comes out. Sorry, the outcome of the patient is good. And I think that story should give a glimpse into the various career opportunities that are available, and you can research any of them and look at the ones that you think you can really key into, and you think that you love, that fits into your traits, and then you can go into them. Certification. So for those various subdomains in healthcare, different regions have different requirements for certification. Most important that you ensure that you enroll in an accredited school or training center at the national level or at the regional level. Note that the earlier mentioned, you should note the earlier mentioned requirements for undergraduate studies. Postgraduate, some of them require postgraduate training, residencies in medical subspecialties. Some of them require masters, PhDs, and then even subspecialty trainings. Like I said earlier, the medical profession, you have to be committed to a lifetime of learning and evolving. So, because the field itself is constantly evolving. Now, the emerging fields in health and medical sciences include telemedicine and virtual medicine. So these days, you don't even have to come to the hospital to be able to, it's not in all cases that you need to come to the hospital to be able to get medical service. You can use technology to be able to see the patient, consult with the patient, and these are ways that which you can use technology to be able to key into medicine. Artificial intelligence and machine learning is becoming an in thing now, and even though we don't have that here in coming up in this country, but these are potential large areas that you can do, especially in the private sector, or you find a way of doing a private public sector partnership. Next generation sequencing for personalized medicine, biomedical engineering and advanced prosthetics, 3D bioprinting for organ models, and regenerative medicine, whereby you're talking about transplant medicine, transplantation, use of prosthetics for those who are amputees. So this is the use of technology in medicine, and these are fields that you can go into. These are new emerging fields. So in conclusion, I hope I'm able to ensure that you understand that the medical field is diverse, and you have an idea of the skills that is needed to be able to excel in this field, with the various skills that are needed in the various sub domains. And I hope that this talk has been able to help individuals to make informed decisions that align with their career goals to promote a balanced and fulfilling career. Thank you very much. I hope it wasn't too long and I didn't bore you. Thank you.
Thank you so much, Dr. Ajayi, for that insightful presentation. It was definitely not boring. You've helped us reflect on how choosing a career in healthcare goes beyond academics. It's also about understanding ourselves, our strengths, and the traits that help us thrive, including empathy, teamwork, good communication, emotional stability. You also shared practical guidance on how to choose a career path. It was also eye-opening to hear about a range of options available in the health sciences, from clinical and lab-based roles to informatics, biotechnology, and support services. And of course, the mention of emerging fields like telemedicine, and other future forward opportunities. It gave us a lot to think about. Thank you so much. So we will now go to Q&A session. If you have any question for Dr. Ajayi, whether it's something he said that stood out to you or something you're just curious about a particular career path, please feel free to raise your hand or type it in the chat box. You can unmute yourselves if you have any questions, please.
Nobody is speaking. How many of you have started thinking of where you want to pitch your tent when you finish, when you graduate, as whatever you are now, maybe as a medical doctor, as a pharmacist, as a dentist? You know, have you thought of some specialization? Anyone? Nobody. Even if nobody, let's hear yes or no.
Hello. Okay. Hello, ma. Sorry. This is. Hello. Uh,
What's complex there? Can you
I
share
think
what is complex with us? Kayode, can you?
Good afternoon, ma'am.
Yeah, good afternoon.
Okay, I said it is a bit complex. I mean, to kind of know I as a person where I'm going to specialize in when I finish my passport, because just like our educator has explained a lot of things to us, there is so much
The
opportunity.
guest lecturer.
The guest lecturer, yes.
Yes.
Yes. So there is so much areas one can venture into. And prior to this lecture, I have noted that I have known some of these things, so that you can venture into all these things. And so it is not because many of us, when we enter medical school, we only knew about the surgeon, you be a surgeon. But over time, we learned that you can be a researcher, you can do many things. So as a person, it is a challenge to me now to be really, really sure at this point. So I was still thinking that okay, maybe when I'm getting closer to the maybe final year and things, I would have been able to gather a lot of information, and maybe by that time I will know which area, which aspect. So that was why I said it was kind of complex.
okay.
Okay.
So
Over to you.
yes, I hear your question and I can relate to it. But one thing I would say is this: I wouldn't want you to leave it to when you are close to finishing or when you are finished, because it's very, very easy for you to fall into the trap of when I get to that bridge, I'll cross. No, it doesn't mean that you spend a lot of time thinking about it, but you should, at the back of your mind at some point in time, start thinking about it. What aspect do I like? Do I want to specialize? Do I not want to specialize? Okay, even if I want to specialize, which aspect am I going to? If I don't want to specialize, what do I want to do? Do I want to key into the other aspects of medicine, or do I want to continue within the line of the clinical practice? So I would advise that you wait till your final year, or to wait till when you are over, because these are some of the mistakes that we made when we were students, because we didn't have opportunities to have talks with forums like this. We're so blindsided. So that tunnel vision of you have to pass pattern farm, you have to pass 1G pediatrics. I had a receipt in pediatrics that I was so blinded by, no, I must not repeat an extra year because I was going to lose my health scholarship. But all of this, at the end of the day, you pass it. Okay, then what next? You'll have lost vital time if you don't start thinking about it and then have a plan of action to be able to know, okay, this is what I want to go into. So that's what I said. Or sorry, that's what I would advise. Then I also saw a question on the group chat about not choosing a career due to only money. And then the question says, will the passion be enough to keep you going if there is poor revenue? I like this question because it's honest and it cuts to the point. Yes, I never said, because it would be fundamentally dishonest and hypocritical of me for me to say that you should not choose career based on the living that you can make out from it. No, I'm not saying you should not put that into consideration, but you should also put that into consideration of based on what you can cope with. I'll give you a personal example. When I finished from medical school, my pops, that's my dad, wanted me to be a surgeon. And the reason he feels that because we had some surgeon friends, they would do surgery, you charge X amount of money, and he felt that I could do it. And I told him, I'm not sure I have what it takes to be a surgeon. Standing for long hours, I'm not sure I can do that. Today, I'm a pathologist. I'm pretty sure I'm doing well financially. So I'm not saying that you should choose a career and not look at the financial aspect of it. No, you should look at the financial aspect of it, look at the possible career opportunities, yes, but at the same time, you look at if it's something that you're going to enjoy. Because if you go ahead and choose a career that makes you miserable, that to me is a recipe for a disaster or a recipe for an unhappy life. So you want something that you do that you enjoy. And once you enjoy it, once you are passionate about it, you will figure out to ensure that you get the right remuneration. That's what I think you should look into it. So you should have a way of balancing both. So this one said, I'm currently considering radiology, concrete yet, but rotating through development has opened my eyes to several opportunities in the field. I got to see it more than just conventional radiographs. That's okay. So if you are interested in radiology, what would you do in this aspect? You look at it, you speak to folks who are in the field, you speak to radiologists, and you talk to them. You can even talk to them concerning emerging fields in radiology. And even though you cannot even speak to them, the world is changing these days. You can listen to podcasts, and this will give you insights. You don't need to listen to them say, I'm listening to podcasts. Maybe you are trying to prep for work, you're in the bedroom or something. You listen to podcasts. I do that a lot. So I listen to podcasts from that diverse folks, visionaries who are in their field, and it gives me different ideas on how to tackle things. So if you are interested in that aspect, you look at it. But at the same time, so you can also move to the next rotation, and you find it also very good. And you also find it very, very interesting. You have to be careful not to get into the trap of you are loving what is new. Do you understand? Because you're just getting to that field. This is your first time of seeing new content, new information about radiology. It's a trap for you to, it might be a trap for you to just say, I like it because it's new. Do you really like it? Do you really enjoy it? If this is what I'm going to do for the rest of my life, would I be comfortable in my skin to look at it? So once you answer those questions and you say yes, then you can then explore it, research deeply into it, and speak to folks who are in the field, and then you can take that decision. Hope I'll be able to answer these questions. I don't know if there are any other questions. Prof, do you have any other thing to add, man?
Okay, somebody is saying something there. Oh, you're sorry, you want to respond to that as well? Considering
On the chat room.
radiology
You
on
already
the chat box.
responded.
Yes,
Oh, you
yes,
did
I have
already.
done that.
Okay. All right. Well, I mean, just like you have said, there is no hard and fast rule. This lecture is just to open your eyes, because we know that many of you are already in senior levels. Many of you are already preparing to graduate, and it's something that we know that there's so many options there for you. And I know one of the options that you are always thinking about is JAPA. You know, even if it is with
I
JAPA,
decided to, I
you
decided to play off that.
you still have to plan. You know, whoever fails to plan, I mean, is then
Planning to fail.
is planning to fail. So even as you're preparing for your exam writing courses, you should once in a while be thinking, okay, so what do I like to do? I mean, what do I take pleasure in doing? Do I like teaching? Somebody who likes to, lead discussion, who is teaching other colleagues during exam and all of that, people like that, they will be better off as academics. Okay. Or when you go through all your postings, when you get to surgery, you say, okay, is it surgery? But when you get to pediatrics, is it this one? Even those that are not doing medicine, there are also subspecialties that you should begin to think about. And the other thing is that you should not, they say, think outside the box. In fact, now they talk about chattering the box, okay? Not just thinking outside the box, but chattering the box and think away. There is no box anywhere. The fact that you're finishing as a medical doctor does not say that you're going to continue in that line. All right, okay? Doctor. Somebody can decide that to even go to something, away from it, can decide to go into data science or decide to go into something very, very different. So don't limit yourself. That's what we are telling you with this, that you should not limit yourself. And then, whether you want to JAPA or you want to still be in Nigeria, don't limit yourself. Start thinking about it, and then start talking to people too. People in the line, start talking to them, and then you'll be able to decide where you want to be. You want to be in academics, or you want to practice as, continue in that line that you have chosen, that you are studying. Or do you want to diversify? Do you want to be an employer of labor? Okay, so any of these you can do. So I pray that God will aid you as you do all of that, and more in particular that you pass in flying colors and have a great career. All right. So I think that's all that I want to contribute, and then to thank Dr. Ajayi for the beautiful lecture. Over.
All right, thank you so much, Ma. And thank you so much once again, Dr. Ajayi, for sharing your time and guidance with us. And to all our scholars, thank you for being part of the conversation. Please don't forget to fill in the attendance form if you haven't already. We look forward to seeing you again at our next mentoring session. On behalf of FAJIM Medicare Foundation management team, thank you all for being here. Until next time, thank you.
Thank you.